Welcome, everybody. Thank you so much for joining us today. I am super excited to have a special guest today. I have Dr. Rebecca White, or Becca White, and she is actually a veterinarian that I am currently using for Bacci, my Malinois, who's almost 14 years old. And some of you have already heard about him, but I wanted to do a follow-up and talk about what I've been doing with Bacci as he's getting older and having physical issues. Is I've been doing acupuncture with him. And I'm so grateful, Becca, that I found you. I moved to Maine about 3 years ago. Before COVID, I had a veterinarian and we had just started doing some acupuncture. Then COVID hit, everything shut down. I moved to Maine. I looked for a veterinarian, couldn't find somebody. And then lo and behold, I kind of stumbled upon somebody. It was actually a friend who mentioned you. And I found that not only do you do acupuncture, but you actually come out to the house, which was wonderful. And so, what I wanted to do today was to just talk a little bit about, acupuncture, so, alternative, therapy, something that I've been doing with Bocce. I know when I first started, I didn't really have, I can't remember what made me first think about acupuncture or if somebody recommended it, but Bocce is about, when he was about 10 years old, he started showing signs of some knuckling over of his back toes,
Mhm.
a lot of weakening of the hind end, but not like your typical thing you see with just an older dog. Like there were neurological things that I was seeing.
Mhm.
And we were doing different medications and things like that. And I just really wasn't seeing improvement. He was just continually like deteriorating very slowly, but was continuing to get worse. And I turned to acupuncture because I had tried other things and they just weren't working. And so I was to the point where what else can I try to slow down this deterioration that I'm seeing? And that was what got me into, looking into acupuncture. So
Mhm.
before we can go on and talk about, my experience, but I want to make sure people have time to hear from you. But
Yeah.
uh, can you just kind of introduce yourself? Tell us a little bit about your practice, which is also fascinating what you do. Coming into the homes and stuff, and I'm also really interested in hearing about like what made you turn to like alternative type. I don't know the official how they call it, therapies or medicine, but
Yep.
why acupuncture? I know you also do other types of
Mhm.
body work, but tell us a little bit about yourself, your practice, and what attracted you to this.
Sure. Well, my name is Rebecca White, as you already introduced me. I graduated from vet school, gosh, almost 10 years ago now. Feels like yesterday sometimes. And I started practicing. I always knew I wanted to do equine medicine right out of school. So that's what I did. I started practicing in North Carolina as an equine ambulatory practitioner. So doing country calls, kind of like your sort of typical large animal veterinarian. And during that time, I always was very fascinated with lameness and sort of locomotion and biomechanics. I was a rider growing up, and it's always kind of gutting when your horse goes lame and frustrating. And I always was seeking to find answers for my own horses growing up. So that is what kind of led me into being really interested in the lameness and biomechanics. And so, very complementary therapies for lameness work is both chiropractic and acupuncture therapies. So, I went back to get some certifications in both acupuncture and chiropractic therapies while I was working as an equine ambulatory practitioner in North Carolina. And then the life of a large animal vet is quite stressful, and I got a little burned out on the emergency work. And my husband got a good job offer back up in Maine, so we moved back north. And I decided to give it a go, sort of just doing these kind of complementary, sort of alternative therapies. And it's been wonderful. I love it so much.
And you've been up in Maine. You've been back up. You're up here about as long as I last 3 years or so. Has it been?
Yes, we moved back up in 2019. I was born here and grew up here in central Maine. I live on the coast now, but yeah, so it was kind of a homecoming for me too.
Yeah, and for those, I mean, it's not very highly populated up here, but those who are listening, if they do happen to be up in Maine, we're around The Mount Desert Island area, Acadia, Bangor, up around that area, if there are any listeners or watchers.
Yep.
But yeah, so like I said, I was super, super excited to connect with you because, it's not like you're in the middle of New Jersey, like where I used to live, where we had so many options.
Right.
But let's talk a little bit about like what is acupuncture,
Sure.
and why would people use it? What do you tend to see of when and why would a person consider using it?
Sure. So you have to open your mind a little bit when you're thinking about acupuncture and traditional Chinese medicine. It sort of works on the principle that there's chi, or like a life force energy that is always sort of flowing through your body, evenly and all day long. And when that energy gets blocked is when you get pain and sometimes disease. So acupuncture typically involves inserting thin sterile needles into specialized acupuncture points, which the aim is to stimulate that blocked energy to flow freely again. So you kind of have to open your mind a little bit. There's not always a lot of kind of Western medicine language around traditional Chinese medicine and how it works. But that's sort of a simplistic way of kind of understanding what your goal is.
And I've asked you because, of course, my background also as a researcher, I'm always like, I was
Yeah.
kind of asking you a lot about the research and like, how does it work and how do we know? And you also talked about, there is research out there. You did talk about how
Yes.
it's activating the endorphins, and you were
Yep.
describing the other day. Talk a little bit about like, treating pain versus like with Bacci, it's not pain. It's kind of like it's a lack of pain. It's like a slow paralysis. But
Sure.
can you just talk a little bit about the types of things, like why somebody might use it, what you're seeing in
Sure.
the
Yeah, so the points that you're treating with the needles, and then there's other ways to stimulate acupuncture points too, which we can talk a little bit more about later too. But they're specialized points in the body, so they tend to have like a high electrical conductivity. They have more nerve endings. They've got more of these little arterioles or very small blood vessels. And so they're specialized points in the body, and they tend to be where like nerves converge or separate, or where a nerve bundle will sort of dive into the fascia. So for my Western brain, I kind of think about it as like I'm stimulating the nervous system, right? And the nervous system is sort of like the motherboard of our body. It drives all of the functions in our body. So basically, when your nervous system isn't functioning properly, your aim is to sort of stimulate it to function again, um, the way it should. Um, so for with Bocce, I think he probably does have some pain too. He's 14 years old, and so he's likely to have multiple areas of arthritis in his body. So, we are actually aiming to treat some pain with him too. But he also has profound neurologic deficits. So, we've talked about before how he's tetraparetic, which means all four of his limbs are not functioning properly. And you can see that frustrates him sometimes. His brain doesn't understand when he goes to move his right front leg, it doesn't always do exactly what he wants it to do. Likely for him, those are, there's, some lesions in the spinal cord somewhere. So he either had, and I suspect with him, he might have had some congenital, um, issues with either his neck or, some other area in his spine that might be causing some impingement in the spinal cord. Probably he has more than one lesion just because of, all
yeah.
four limbs are affected. But yeah, he's a great example of, I get phone calls about dogs like him all the time. A lot of older dogs with profound arthritis and weakness in the hind end, and sometimes even, pain related to those conditions as well.
Yeah. And what I saw with Bocce, like the first time I started, when he very first went to see somebody and had acupuncture, it was over 3 years ago. It was before we moved up here, and right before COVID kind of took off. And what I noticed was, and you can talk about how typical this is at first, I didn't really see any change. And they were doing just the needles. And maybe you can talk a little bit about how you can actually have the little like electrical stimulation.
Yep.
And the first few sessions, and they said what they told me was, we have to kind of go on a regular basis, and sometimes it takes a while before you start to see anything, if you see any improvement.
Hmm.
Um, and they said, I'm not looking for some kind of miracle that's going to heal him. I know he's not going to be healed. I'm just looking at, kind of delaying or countering or slowing down this kind of degeneration that I'm seeing of, what's happening to his body.
Yep.
And I can't remember how long it was. I think it was after about 4 sessions. We were going, I
Hmm.
think, at least once a week or maybe twice a week at first, once a week or twice a week. And it probably took about 2 to 4 weeks. And
Yep.
I noticed this was the only thing different I did with him. Nothing else changed. And I noticed that after the acupuncture, he was kind of dragging and his knuckles were folding under.
Hmm.
And after the acupuncture, he actually like within 48 hours afterwards, he like had a spring to his step, and he was
Yeah. That's
lifting his
wonderful.
feet. He had a spring, and then after a while, like after about 7 days, I would see it start to regress a little, and then we would go
Hmm.
again, and then he would have that spring in his steps, and then a few years later, we just started again. Of course, he's worse off than he was 3 years ago.
Hmm.
Um, and now he was having some issues when I first met you. He had a leg that was completely would collapse underneath him. He was
Hmm.
doing a lot of knuckling over, really struggling with mobility wise. And again, I didn't see instant improvement, but after a few weeks, and again, I wasn't changing anything else. I did add a little bit of CBD. I don't know how much that played an influence, but
Hmm.
I did see noticeable for a number of weeks. He was walking better. He was not knuckling over. The leg collapsing was not happening.
Hmm.
It's been a period of time, and now we're kind of up and down, up and down. Um,
Sure.
but that's what I've seen with him. What what can you say as far as what you've seen with clients, or what do we know of whether does it work for some, does it not? Is there a progression? If it does, if you do see
Mm.
improvement, is there a progression of what you typically see?
Yeah, so just like any treatment modality, some patients are going to respond better than others, and I think there's a variety of things that factor into why some patients and humans as well respond to acupuncture and some don't. But I think typically it sounds like Bacci was sort of the poster child for what I typically tell people. If you have a very chronic, long-standing condition, um, you should try 3 to 5 treatments at 1 to 2 week intervals before you give up on acupuncture, as being a helpful therapy for whatever condition your dog is dealing with. And I think that holds pretty true. It's very different depending on, the animal and what you're treating and how severe the condition is. Sometimes you'll see effects right away, and others it takes a little while to build up into the system until you start to see some positive effects. And then it may even be several treatments before you really see sort of maximal effect of what you're going to get with acupuncture.
Yeah, yeah, because like I said, I definitely I saw a difference over time. I don't know if this is true, but I felt like he responded better when you had that stimulation. Can you talk a little
Right.
bit about,
Sure.
what it's about?
Yeah, so there's a lot of different ways to stimulate an acupuncture point. So, from anything from acupressure, which is exactly what it sounds like, it's you locate the point and you use the tip of your finger usually. You could probably use an instrument like a pen or something if you wanted to, and you just slowly apply pressure to the point. You can hold, you can apply and let go. There's different ways to stimulate the points. The dry needling, which is just inserting the thin little sterile needles. And then, usually the treatment would last for like 20 minutes or so. There's
Mhm.
electroacupuncture, which we do a lot with Bocce, where I'll place the needles into the points and then attach little electrodes that are attached to a box that I can set the frequency on, and it'll actually apply an electrical stimulation depending on what we're treating. So, and typically a lower frequency if we're trying to affect nervous stimulation, and a higher frequency if we're trying to get an analgesic or a pain, sort of a lessening of pain effect. And then there's other things like moxa, which is it's like an herbal stick that you can burn. So using heat can actually kind of help stimulate the points too. And then aqua acupuncture, which is injecting something into a point. So, like vitamin B12 or saline are some common things to use in an acupuncture point. That and the electro stimulation are sort of techniques that are designed to kind of increase the length of sort of treatment time that you get out of stimulating a point, if that makes sense.
Yep, yep. And are there any potential like side effects or, certain dogs that maybe are not a good candidate for it?
Sure. Well, the number one would be if they don't tolerate the needles well. So, if you have a very needle shy or a
Mm.
very, a dog that might be very, very guarded around strangers, that they might not be the best candidate initially for the needles. Although most patients I find will accept at least a couple needles. Then you can, stimulate the points with other methods. We talked about acupressure, sometimes laser. You can stimulate the points with laser too. And then certain conditions like fractures and open wounds, tumors, cancer, and stuff, you want to be very careful about. You don't really want to be stimulating cancer growth. So that's one that you should be very kind of cautious with acupuncture. Pregnancy is one that I usually will wait until the patient has had the puppies or the foals or whatever it is you're dealing with until after they've foaled or whatever to do acupuncture. um, and then if there's certain skin conditions like dermatitis, you'd want to be careful about sticking needles through the skin. Anytime you're putting a needle into the skin, you do risk a little bit of infection. So if you've got any kind of increased potential for infection, I would sort of not place needles in those points if you've got some kind of scurf or something going on in the skin.
Yep, yeah. And yeah, I was just thinking Bacci is really great because he just kind of lies down on his bed and he's good and doesn't move. But I think about other Malinois, I'm like, yeah, he might not be the best candidate
Yes, that's
for
the
it.
other thing is they get a
Yeah,
bit wiggly, the dog patients. The horses are a little bit they stand a little bit more still usually, but yeah, the the dogs can wiggle around.
yeah. And can you, for those who have never done it with their dogs, can you just kind of walk through, like for you, like if somebody's doing it for the first time, like what would an owner expect kind of with that first visit?
Sure. Yeah, so it would entail a physical exam, just like similar to when you go to your vet. I don't usually pull out my stethoscope, but I do run my hands along the meridians and I palpate because I also do chiropractic. I usually do like a pretty detailed musculoskeletal exam too. So I'll flex and extend all the joints and palpate along the back, and I'm feeling for muscle tone and tension and any areas of pain that I might find. I like to watch the dog move around. So I'll usually, for the dogs, that's as simple as just kind of having them follow the owner around, maybe with a little cookie incentive, and just get a feel for, sort of how they're moving. Or do they have any lameness? Do they move the same to the right and to the left? I take a look at their posture. Um, and then we get started with the needles, and usually that's the patient is either, if they're quiet, they can stand for it, or lying down is typically how we work when we're needling.
Yep, yep. And I'm curious because Bocce's my dog, so you don't work with me with horses, but I know that we have followers and we have listeners that also have horses, or
Hmm.
maybe they're just horses. Is there anything kind of unique or different or similar when you think about doing it with horses? I think I was telling my dad about it, and I think he was asking about, oh, you must have like really big needles with horses, and I'm
Yeah.
like, a horse can feel a little fly on their skin. They're
Yeah,
super sensitive,
that's right.
but I'm just curious as far as differences, kind of working with horses versus dogs, similarities, differences.
Yeah. So the theories are the same. You're aiming to do the same thing, stimulate, that chi flow and make sure that everything is flowing right. You're picking your points based on, what you're aiming to treat. Um, the needle sizes are a little bit different, although I use very, very small needles on certain parts of the horse too. So it really depends on the area of the body that you're treating. And, some of the acupuncture points are like right over joints. So you obviously don't want to
Mhm.
go puncturing into joints and things like that. So You have to really know your anatomy, but definitely I've used even 6-inch long needles in horses if I'm really trying to stimulate through a big, deep muscle belly, which I would never pull out that long of a needle for a dog. So a little bit of a difference in the needle size. But yeah, the theories are all the same. And there's some horses that don't tolerate the needles either, just like some of the
Mhm.
dogs. So it's just about kind of getting to know your patient.
Yep, yeah. And I had a couple people asking like how if somebody's trying to find somebody to work with their dog or horse,
Yep,
can you just talk a little bit about like how do you vet out a person? What's the training that somebody goes through whenever you're trying to
sure.
find somebody to do this kind of work with your animal?
Yep. So only licensed veterinarians are allowed to be performing acupuncture therapies on animals in the United States. So, number one, they have to be a veterinarian. And then, the program that I went through was at the Chi Institute in Florida, and I believe
Mhm.
there's one other one, which is the IVIS, which is like International Veterinary Acupuncture Society, I believe. There may be others by now. That was a few years ago. But a good resource is tcvm.com. So that stands for Traditional Chinese Veterinary Medicine. And that would be a really good resource for finding veterinarians who are certified in acupuncture in your area.
Perfect. And is it more kind of like a national, or are there different state regulations, things that vary amongst states?
So we don't really have like state rules are different for everything in veterinary medicine. Like you have to get a different license for every state you practice in. And so they don't communicate well in general. And that definitely translates into the alternative therapy world as well. Um, in general, acupuncture tends to be a little bit easier because that has to be a veterinarian, like, end of story. Anytime you're puncturing the skin with any kind of needle or anything, it's sort of considered a veterinary procedure. And so that only can be done by licensed veterinarians. The acupuncture or the chiropractic world is a little bit more gray. We don't need to get into that. But I think as long as you search for a veterinarian and then look for, them to have that
Mm,
certification.
perfect, perfect. And I'm wondering, I just jotted down some questions ahead of time. I want to make sure. I think I've hit upon most of them, but one question that I was curious to hear from you is: have you found that there's some common misconceptions or
Mm.
fears or questions that people have that maybe we haven't covered today?
Mm. Yeah, I think the biggest one probably would be if somebody doesn't have either personal experience with acupuncture, usually it's personal experience with acupuncture, then they may not think to try it for whatever condition your pet might be experiencing. um, or maybe not really believing that it works. So I think that's sort of the biggest thing is just to consider that maybe whatever condition, anything from musculoskeletal injuries or arthritis, neurologic conditions like what Bacci's dealing with, GI conditions, other chronic systemic health conditions like chronic eye inflammations or kidney disease, or really honestly the list is everything that you would go see your veterinarian for. You can give it a go with acupuncture. And the reason I call my practice integrated veterinary solutions is that I really believe you need a multimodal approach to healthcare for humans and animals. And so that means, you know, going the Western medicine route with your medications and your imaging and your diagnostics, and then also adding in, what acupuncture could help with too. And in some cases, they work great together. Like you may be able to decrease some of the doses of the medications that your pet is on if you're also getting acupuncture treatment. So I just would say that just opening your mind and considering, you know, trying alternative therapies, as an integrated approach to your pet's health care.
Yeah, and like I said, for me, it was whenever I tried other things, tried the drugs and wasn't getting the kind of results. So it's like, what do I have to lose? And I
Hmm.
also have I have a client of mine who she she has different body pains from like an accident she had been in, And when I mentioned that I was doing the acupuncture with the dog, like she has it on herself, and she was just like going on. She's like, it's amazing, and it's like
Yeah.
really helps increase her pain. And my family, I have a lot of people in the medical field and nurses and stuff. My mom and my sister and my aunt and my my mom told me this, so it's not. I think it's correct, but she was saying that my brother-in-law was doing acupuncture for back pain,
Mhm.
and and had felt that it really made a difference. So,
Mhm.
I think maybe I was maybe a little, I mean, not skeptical to not try it, but I was kind of like, does this really work? But I was to
Yeah.
the point, well, let me give it a try and see. And like I said, I saw improvement, and there was nothing else that I changed. And I've gotten human versions of stories of people saying, for some people it also made a difference. So I agree with you. It's
Definitely.
kind of, give it a, it's worth it to give it a try in some of these areas if other things haven't worked. There is one thing.
Yeah.
I was talking to somebody the other day, and I think she didn't say it outright, but I think she was a little concerned, like, will it hurt my dog? I don't want to hurt my dog.
Mm. Mhm.
And she was like, and it's like Bacci. It's like, the dog's deteriorating, older dog. It's kind of like
Yep.
we're just trying to do everything we can to keep them comfortable.
Mhm.
But what would you say to somebody if they're like, are you gonna hurt my dog? Is this gonna hurt my dog's
Yeah,
dignity?
that's a common question. I mean, it definitely they are needles, and so there is like a they can feel the insertion of the needles. They're very, very thin, they're very, very small, and I would say, my experience is that most animals tolerate it quite well. I do find that maybe there are some areas where the dog says, I don't really think I want one there, and I respect that, and we just alter our treatment plan a little bit. And there are a few that will reject the needles altogether, and that's okay. There's other ways to, still stimulate those points and use some of the other tenets of the Chinese, medicine system. So uh, I would say it's worth a try. And if your particular pet definitely is, says definitely not on the needles, there's other ways that we can reach the same goals.
Yeah, yeah. I guess you can kind of relate it to like humans. Some
Hmm.
people they're like, oh my, like,
Exactly.
keep a needle away from me, and they'll like faint. And then like for
Yeah.
me, it's like cleaning my teeth, going to the dentist or scraping. I'm like, you could stick needles in my arm all day long. I'd rather have
Right.
needles in my arm, go draw blood than go go
That's
to the
it.
dentist
That's it.
and get my
Exactly.
teeth clean. And that's very individual, right? So I
That's
imagine it's
right.
like, oh,
It
some might
is. Yep.
some will be like, I didn't even feel it, and another one could
Yep.
be like, what are you doing to me?
Exactly. Exactly.
Oh,
Yep. They've got
awesome.
personalities too, for sure.
Yeah. So are there, I think I went through all the questions I jotted down ahead of time, and we talked about ahead of time. Is there anything else that you might want to add or tell people who are thinking about, giving it a try with acupuncture?
Yeah, I think one of the big things that I love about these sort of complementary treatment modalities like acupuncture and chiropractic is that you have the ability to actually prevent, um, you know, bigger lamenesses down the road or more advanced disease down the road. It's a modality where you can sometimes detect things a little bit earlier than you can with some of like our Western diagnostics. And so that's a really powerful tool. So I would encourage people, even if you're not sure that your dog might even need acupuncture, it could be a nice sort of thing to do to have them checked annually by a practitioner that does the acupuncture or chiropractic because they can sometimes find little blockages or little abnormalities in the posture before it becomes a lameness or a more advanced disease process. And that's one of the things that I think is so beautiful about these therapies.
That's a great thing, that I hadn't thought about, because I know I have a lot of people that follow, that are in the sport and working dog world. And
Hmm.
so think of it as kind of like a preventative, or a lot of these dogs are just so tough that you think they're fine, but they actually have their aches and pains and things going on. So that's a really
Hmm.
good point. And it made me think about, I wanted to mention, I didn't, is when you did that first visit with Bocce and you kind of checked the whole body and you went through and you said, oh, he seems a little stiff here, a little achy, or you might want to massage this, you're doing up
Hmm.
around the jaw. And that was
Mhm.
very, I took a whole bunch of notes, so that,
Mhm.
like, when you're not here in these body parts that were, maybe I didn't realize how maybe stiff he was, or he might have been, a little bit sensitive in an area that I might have missed.
Mhm.
And even though it might not have been like, oh my gosh, he's, hurt or injured, but just kind of a preventative and say, oh, let's do a little bit of extra massage, or, he's a little bit sensitive around the neck. So
Right.
that's really great information. Like I said, those people that have really active dogs, sport dogs, working dogs, you want to stay on top of that stuff. And the dogs are, these high drive dogs are so good at giving such subtle signs of an issue that we miss it.
Right. Yeah. And I
um,
remember, I think you said something in Bocce's history. He had like a little episode maybe in his neck when he was like 5.
yeah,
And so that would have been the perfect time to, have him seen, checked over. It could be something as simple as, he strained something when he was doing one of his exercises.
yeah,
Or it could have been an early sign of something,
yeah,
more insidious. And so that's a perfect example of, why it's good to kind of get into some maintenance care with this
yeah.
kind of thing, especially if you've got athletes.
Yeah, yeah. And I know you work with equine athletes. Do you have some
Mhm.
of them who do it as maintenance, like how frequently they might see you
Yes,
for maintenance?
definitely. Yeah, it depends a little bit on what we're treating and what we're aiming to achieve. My patients that are, working 6 days a week and showing on the weekends, I like to see them every 2 to 3 months when they're competing and working hard, just to kind of make sure that they're balanced and, working in their optimal mechanics.
Yep.
That's the way to prevent injuries. So I love that. And then if they're a little bit less, have a little bit less of an intense schedule, then checking in with them like once or twice a year, spring and fall, before they, get geared up for the summer season, that kind of thing. So,
That makes sense. Awesome. So as we mentioned, you are up in Maine, but I
mhm,
wanted people to know we'll include information here with the video. If they want to reach out, we'll put your website, contact information. I know
right.
with my Northeast Canine Conditioning, where people might be receiving this interview and hearing from us. We work predominantly with sport and working dogs, canine fitness. We have an online program, but we work with canine fitness. The focus is on healthy dogs, dogs that have already been cleared by a vet, or don't have issues. But I imagine there are some, you can't do that's my dog acting in the background. You can't do acupuncture, virtually, but I imagine there are some ways that you could, if somebody wanted to reach out to you,
Mhm,
and get some feedback, ask questions, support. Do you want to just give a couple comments about if people don't live nearby, if they wanted to reach out, some
sure.
things that you might be able to support them or guide them on their journey with their horses or their dogs?
Sure. Yeah, I mean, I have a lot of clients who, and I will refer them back to their veterinarian for imaging, or if I'm a big proponent of more information is always better. So I stay in communication with referring veterinarians. But one of the big things I find is that people kind of will use me to sort of help interpret what their vet has said about the imaging and what's going on with their patient, and then how I might be able to help with that. So sometimes just having somebody to ask some questions too about like, is this a good time to maybe think about acupuncture or chiropractic? And if so, what should I be looking at? Like, this is what's going on. So I think that that can be valuable to have somebody to help guide you through that process.
Definitely, definitely. And I find, like, with the canine fitness, like with the athletes and stuff, a lot of times, not everybody has access to a veterinarian who specializes in athletes, and just
Mhm.
like you said, knowing, getting a second opinion, getting feedback, or, even knowing what to explore. They might say, hey, I have a horse or a dog with these issues. I've tried this, and this. It's not working. What recommendations do you have? Where might I go?
Right.
So,
Yep.
perfect, perfect.
hmm Yep.
Well, we'll definitely include your information. So, people who are interested, feel free to reach out to Dr. Becca White, and we would love to hear your questions, and we'll be sharing more information. And I really, really appreciate you taking the time to chat about this. And we actually, you've been seeing us once a week, so we'll be seeing you soon. with
Sounds
Bacci.
good.
But thank you so much, and I really appreciate you taking the time.
It was my pleasure. Thank you for having me.
All right, bye bye.
Bye.